Hello, everybody. My name is Dr. Nitu Bajekal. I'm a senior consultant gynecologist and a women's health expert with over 35 years of clinical experience. Today, I'm going to try and answer some of the questions that you have put to me on behalf of TOTM. My bleed is so heavy, so should I be concerned? Yes. Yes, if you think your periods are heavy, then they are. You don't need a doctor to tell you that your periods are heavy. You should see your doctor after taking details of all your menstrual cycles for at least the last 3, preferably 6 months, so that they actually have the information. But if you think your periods are heavy and if you find that you're having leaking, if you're having to use double protection, if you have associated pain, including pain on intercourse, if you find that you're passing clots that are larger than your thumbnail, if you find that your periods are lasting more than 7 days and are very heavy, you do need to seek help. Do not assume that having heavy periods is normal and that it runs in families, because it is the commonest cause. 1 in 5 women will be anemic because of heavy periods and is often underdiagnosed. If, when you see your doctor, you say that your periods are heavy, you should request a blood test, certainly at the very least, so that you can check that you're not anemic. And there is a good case for you to be considered for a pelvic ultrasound scan to rule out common conditions such as thickening of the lining, known as endometrial polyps, that can cause heavy periods, fibroids, especially when they're located within the cavity. But otherwise, large fibroids can also cause heavy periods, as well as conditions such as endometriosis, or if you have conditions like polycystic ovary syndrome, where you may have missed periods and then start having really heavy prolonged periods. So if you have periods that last longer than 7 days, you're passing clots, you have other associated symptoms of pain and painful sex, if you have a family history of endometriosis and fibroids, if you have previously been diagnosed with these conditions, if you find that your day-to-day quality of life is affected by your periods, if you're leaking, if you're having to use double protection, please seek help and ask for the necessary tests if and as appropriate. You may need more than one test, and you may need to be referred to a specialist and a gynecologist for further treatment if it is picked up that you need help. Just taking iron tablets and an iron-rich diet, while that is helpful, will not stop the underlying problem. Why do I still get ovulation pain when I'm on the pill? This really depends upon the type of contraceptive pill you're on. If you're on the progesterone-only pill, it does not consistently stop ovulation. In fact, 4 in 10 women will continue to ovulate, as the progesterone-only pill works by thinning the lining of the womb rather than by stopping ovulation. So you may continue to have some ovulation pain. If, on the other hand, you're on the combined oral contraceptive pill, it works by stopping ovulation. And so really, ovulation pain is not something that we see in those who take the combined oral contraceptive pill. If you're having pain, do not just assume it's ovulation pain. Make sure that you seek help, because it may be that you have an ovarian cyst that needs treatment. You may have other underlying conditions such as endometriosis or pelvic inflammatory disease. You may need to have an STI check. So it's really important that you don't just assume that this is ovulation pain. It may also be urinary or bowel symptoms that are causing you to think that you have pain. But if it is always mid-cycle, then it is not because of the combined oral contraceptive pill, unless you're not taking it in the appropriate way, as it works by stopping ovulation. But with the progesterone-only pill, you may ovulate occasionally, and so you may be having those pains. How do I know if my period pain is something more serious, and how do I speak to my GP regarding these symptoms? This is a common question. And my first advice to you is to actually make a note over a couple of months of your pain. When does it arrive? When does it get better? Is it at the start of your period? Does it start a week or 2 before your period? These things are important. What medications actually make it better? What kind of exercise and lifestyle changes has helped to make it better? These are important questions that you need to know before you go to see your doctor. So do keep this on a regular diary or using an app, so that you can actually record your symptoms, so that you're in much more control when you go to see your doctor. Also note down whether you have associated symptoms such as heavy periods, painful sex, and chronic fatigue, or any other symptoms that make you suspect that you may have conditions such as endometriosis or conditions such as fibroids or pelvic inflammatory disease. If your regular medications are not helping you, if you find that your day-to-day quality of life is affected by the period pain, you must seek help sooner rather than later. It is much better to diagnose conditions like endometriosis sooner rather than later, and it can take up to 7 years to pick up conditions like endometriosis. Endometriosis is a condition that is a chronic condition where there is no cure, but you can certainly control it. It's a condition where lining, similar to the lining of your womb, grows outside and sticks itself to ovaries, causing painful ovarian cysts, scarring, and when it sticks itself to the bowel and to the bladder and to the back of your womb. So it also has implications for fertility in the future and can cause chronic pain and fatigue and symptoms very similar to irritable bowel syndrome. So do make sure that you are seeking help if you are having period pain that does not respond to regular medications, is affecting the quality of your life. What should I do if I feel that a doctor is invalidating my symptoms? This can happen for a number of reasons. My advice is, again, before you make an appointment to see your doctor, make a list of all your clinical symptoms, including your menstrual cycle details, how heavy your periods are, how long they are, how regular they are. You should know your medication history, your previous medical and surgical history, and take along any notes that you may have, your smear history, and any symptoms that affect your mood, as well as physical symptoms such as bloating or pain on intercourse. These are all important things that if you note down, you have much more time to discuss what is really wrong with you. If, however, you feel that your doctor is dismissive of your symptoms and you feel that there is something more, then I would strongly recommend that you consider changing your doctor. There are plenty of empathetic and good health professionals around who are happy to listen to your symptoms and help you come to a diagnosis. It is possible that you can just be reassured and you don't need any further tests, but you should feel that the doctor has heard you and listened to all your symptoms and then come to a considered decision, giving you resources so that you feel confident that the right decisions have been taken. Because sometimes you may think, having read somewhere, that you need particular tests, but actually they are not in your best interest. But again, as I said, if you feel that your doctor is not listening to you, you feel dismissed about your symptoms, you are well within your rights to seek a second opinion and to ask for another doctor and also to empower yourself with all the knowledge so that you can take it to your doctor and actually say you think you have a particular condition and you would like certain tests. It's their responsibility to actually explain to you in detail and reassure you why you do or do not need them and refer you on to somebody who probably has more experience in a particular area. What is your opinion about hormonal contraceptives to control symptoms, and what alternatives are there for people that can't or don't want to take this route? There are plenty of non-contraceptive benefits that I want to highlight. These non-contraceptive benefits include management of painful periods, heavy periods, conditions such as polycystic ovary syndrome, endometriosis, and symptoms related to fibroids as well. For most people, it is very safe, but if you do not want to take it, there are other options depending on whether you want contraceptive benefits or non-contraceptive benefits. There are some women who can't take the pill because of family history or personal history, such as thrombosis and stroke, as well as other reasons. But for those who don't want to take it, it's certainly worth exploring other forms of hormonal contraception, such as the progesterone-only implant, injections, or the intrauterine system. Also, you should be aware that natural methods of contraception are not particularly safe, they're not dependable, and so it should really be used if you do not mind getting pregnant, but it doesn't have other non-contraceptive benefits such as managing acne and hair growth, for example, in conditions such as polycystic ovary syndrome, and in managing pain in conditions such as endometriosis. However, there are several other options, including medical and surgical options, as well as dietary and lifestyle changes that should be brought in whether you're on the pill or not. And this should be with the help of a qualified health professional. I have endometriosis and find sex really painful. Is there anything I can do to help with this? Yes, you need to be seen by a specialist who manages those with endometriosis and who has experience in managing this chronic condition. Painful sex is a common feature in endometriosis and can be for a number of reasons. You will need a detailed examination as well as detailed imaging techniques such as a pelvic ultrasound scan and sometimes a pelvic MRI, as well as proceeding to be considered for surgery through keyhole procedures so that you can have a diagnosis of endometriosis as well as treatment to remove scar tissue and nodules and treatment of ovarian cysts, all of which can contribute to painful sex. But painful sex can be both deep and superficial, and there can be other reasons such as vaginismus, as well as skin conditions such as eczema and lichen sclerosis, or infections such as thrush or a sexually transmitted infection that can also cause pain, both superficial and deep. So don't just assume always that painful sex is because of endometriosis, and you must seek out other causes so that you have covered all bases. Always try and involve a partner if you have one so that they are more sympathetic and are able to understand, and making dietary and lifestyle changes in endometriosis, as well as simple vulval and vaginal care measures such as avoiding soaps and perfume toiletries, using non-biological washing liquids, using skin-sensitive menstrual products. These are all really important and can go a long way in helping, as well as changing positions and using certain lubricants can also help with painful sex. But it is so important that you ask and seek the help of a specialist who can actually manage situations such as endometriosis, but also can address painful sex in detail. I hope you found this session useful, and I look forward to seeing you again. Do visit my website www.nitubajekal.com and follow me on social media at Dr Nitu Bajekal, where I answer a lot of these questions and have lots of free fact sheets where you can hopefully read in your own time and use them to improve your menstrual health as well as your overall health. Thank you.